Good evening, I'm Adrienne Arsenault.
And I'm Andrew Chang. Tonight, new allegations against former Governor General Julie Payette. An official report says she engaged in unwelcome physical contact.
Also tonight, COVID variants in Canada.
Let me be blunt. This now is very concerning.
Where they are, what you need to know.
We will continue to work closely with Europe.
Should Ottawa be worried about Canada's vaccine supply coming from the EU?
And dismantling stereotypes in stores.
There's a belief that racialized customers are poor, are thieves.
Plus, leveling the field for Black suppliers. This is The National. We begin tonight with the CBC News exclusive. New details of what Julie Payette's former staff reported they endured while working for the Governor General.
Allegations that go beyond verbal harassment. It all comes just days after Payette resigned, on the heels of a scathing report into claims she created a toxic workplace environment. Now, Ashley Burke broke this story. Ashley, what are you hearing from your sources about this?
Well, we have been reporting all along that former employees and public servants have complained about verbal and emotional abuse from the former Governor General Julie Payette, but tonight we are learning that that behavior at some times went from verbal to physical. In public, it was a job filled with ceremony and tradition, but behind closed doors, allegations of a darker side.
And this report had some disturbing conclusions. And those conversations led the Governor General to conclude that she should offer her resignation.
They will bully you until you either agree or leave.
Since July, CBC News has been reporting on allegations from former Rideau Hall staff and public servants claiming Julie Payette belittled, berated, and publicly humiliated employees. Her second-in-command, Assunta De Lorenzo, was also accused of bullying staff. Now multiple sources say there were instances where Payette's anger turned into unwanted physical contact, and some felt threatened. Sources say those details are included in testimony in the Workplace Review Report. Payette received a copy last week. Days later, she resigned, saying everyone has a right to a healthy and safe work environment at all times and under all circumstances. Tensions have arisen at Rideau Hall over the past few months, and for that, I am sorry. We all experience things differently, but we should always strive to do better and be attentive to one another's perceptions. Now, the report is still private, but the government does intend to make it public and release a redacted version of this report under privacy laws.
Okay, and what are Rideau Hall and the government saying tonight?
Well, Rideau Hall says that it hasn't seen the report, so it can't comment on it. The Prime Minister's office directed us to the Privy Council office, and it says that in order to maintain its impartiality, that it cannot comment on specifics of this report, but did say that everyone deserves a safe and healthy environment and that the government takes this very seriously.
Okay, Ashley Burke, thank you very much.
Thank you.
Canadian health officials are worried and warning about a new and growing pandemic danger. At least 3 significant coronavirus variants have been identified around the world. 2 of them already have a toehold in this country. The variant first discovered in the UK has been confirmed in at least 4 provinces: BC, Alberta, Ontario, and Quebec. And the one first found in South Africa, now confirmed in BC and Alberta, both more contagious, both bringing questions about vaccine effectiveness. Rafi Boudjikanian is tracking the story tonight.
From the variant first detected in the UK in this long-term care home in Barrie, Ontario, to that one and the variant first seen in South Africa, present in Alberta, including a case that does not appear travel-related.
Let me be blunt. This now is very concerning.
Those new coronavirus strains are in Canada. One study out of Simon Fraser University says with its higher transmission rates, the variant first found in the UK could be especially dangerous, potentially 20,000 cases per day by March, if no further measures are taken by then. Its authors say governments should act now.
Defining non-essential travel and really limiting it, so reducing the number of international travelers coming into Canada, making sure when people do come that we're a bit stricter about what we ask people to do. Right now we ask people to isolate at home. Household members aren't asked to isolate.
But no new restrictions yet from Ottawa.
Because we already have some of the strongest measures anywhere, one just has to remember that we are reliant on supply chains from around the world.
Some provinces are taking steps. Quebec Provincial Police will make sure returning international travelers respect their quarantine. Like others, that province wants more from Ottawa.
It's time to act. We can either ban non-essential travels or isolate travelers in hotels.
We are going to amend our public health orders to ensure that anyone returning to Manitoba, including Western Canada, must self-isolate for a period of 14 days.
Alberta says not a bad idea, but it won't follow suit just yet.
Again, this is something that can remind us all that traveling outside of our home province right now is not something we should be doing unless for essential purposes.
So Rafi, walk us through what we know about the effectiveness of vaccines against these variants.
There is some cause for optimism there. Moderna and Pfizer both say their vaccines are effective against the new variants, though less so when it comes to the strain first detected in South Africa. Those Simon Fraser experts say some protective measures could be set up for travelers, including vaccinating essential workers such as truck drivers who have to cross borders, Adrian.
All right, Rafi, we'll be watching. Thank you for this.
You're welcome.
Okay, let's bring in infectious diseases specialist Dr. Zain Chagla now. And Dr. Chagla, help us navigate the risk here. I mean, knowing what we know about how much more contagious these variants are potentially, shouldn't we be tightening up our lives even further?
So it's important to know these viruses and these variants still spread the same way. And realistically, nothing has changed in that standpoint. Yes, when one is exposed, there's a higher risk of getting infected. And so it means that our blind spots, like getting together with individuals even for a short amount of time, may be more risky than they were before. But the same public health principles still apply: masking, better ventilation indoors, outdoors over indoors, physical distancing, getting tested while sick, and excluding yourself while sick. And they still work even with this variant in mind.
Well, except there's still community spread in the country, right? So with the greater risk here, I mean, isn't this a small problem today, but one that could potentially explode in the future?
Yeah, and you look at the example of Ireland, where they had this variant circulating while Christmas season was ongoing and people were out and about. They went through a period of restrictions and a reinforcement of public health measures, and they've seen their cases go down week after week after week. And so, it's a good reminder that public health messaging and public health restrictions do work for this variant if it does get out of control.
Follow the guidelines, I think, is the bottom line here. Dr. Chagla, thank you so much for your time.
No problem.
That the variant first found in the UK now has a presence in an Ontario long-term care home is just another reason why more doctors are demanding action. David Common shows us again tonight just how lethal this situation is.
The horror for Ahmed Daba, escaping the war in Syria for safety in Canada, only to see his 19-year-old son Yassine die of COVID. He'd been a cleaner at this home, itself in outbreak. We found him sleeping, he says, dead in his room. The torment of staff in long-term care precedes the pandemic.
Never enough staffing in any long-term.
A CBC Marketplace investigation 2 years ago showed workers barely able to keep up with demand.
Long-term care residents get 2 showers a week.
Shana Gogo is a PSW in Ontario. This is her today at work. And like 40% of Ontario homes, it is facing an outbreak. She's the union steward and says they are still short-staffed.
We treat our animals better in some ways. 3 staff for 27 adults requiring different levels of care. The ratio of staff to residents is not right. Their quality of life should be a lot better.
There is no minimum ratio in most of Canada for such workers to residents, and a group of doctors and advocates calls the situation a humanitarian crisis, urging Ontario's government, where the care home deaths are again surging, to embark on an urgent training and recruitment effort for more staff, make 70% of them full-time so staff aren't forced to work elsewhere, and right now call upon the military for help.
It's hard to believe the extent to which we are really abandoning the elderly in long-term care in terms of the care that they are not being provided. And they've been not provided that care for quite a while in many of the homes.
Ontario's government has responded to the calls, saying multiple measures taken so far are stabilizing the sector, even as some homes now face near total infection of their residents. David Common, CBC News, Toronto.
Now, any disruption to the vaccine supply chain is quite literally a matter of life or death. And now Canada is warily watching a situation developing overseas. As Renee Filipponi tells us, a shortage of the UK's AstraZeneca vaccine has the EU threatening to restrict its vaccine exports.
Violence in the Netherlands by anti-COVID curfew rioters, labeled by authorities as criminals. But there is anger simmering across Europe about its COVID response and struggling vaccine rollout. The concerns were made worse when vaccine manufacturer AstraZeneca revealed it is having a major supply chain problem. That vaccine is primarily made in the UK and is days away from being approved in Europe.
Europe invested billions to help develop the world's first COVID-19 vaccines, to create a truly global common good. And now the companies must deliver.
The European target is to vaccinate 70% of its population by the summer. The EU is relying on the AstraZeneca vaccine to get it done. And now the EU is warning there could be restrictions on exports of European-made vaccines, like the one by Pfizer-BioNTech. It's not about EU first, it's about Europe's fair share, says the German health minister. This move is seen as a direct hit at post-Brexit Britain, who were the first to start vaccinating and have now inoculated 5 times more people per capita than Europe.
Obviously, we expect and hope that our EU friends will honour all contracts.
This back and forth is raising concerns with the WHO.
Vaccine nationalism might serve short-term political goals, but it's in every nation's own interest to support vaccine equity.
The urgency to vaccinate people in the UK couldn't be more dire as the death count surpassed 100,000 today, and the government expects a lot more in the coming weeks before the effects of the vaccine are felt. Renee Filipponi, CBC News, London.
Now, any European Union restrictions could mean trouble for Canada's vaccine supply too, since that's where it comes from. Hannah Thibodeau on how the Prime Minister was trying to calm concerns today.
The contracts that we've signed and the supply chains that we have established with European manufacturers are in good shape.
In good shape for now. But if the European Union puts export controls in place, both Pfizer-BioNTech and Moderna may have to seek approval before shipping vaccines to countries like Canada. Pfizer is manufactured in Belgium. The Moderna vaccine is made in Switzerland, not an EU country, but the vials are filled in Spain. The Prime Minister says he received assurances from the CEO of Moderna.
It was very, very clear that the Canadian contracts that have been signed and the delivery schedule laid out will be respected.
But could a company ignore an export order? This trade lawyer says not likely.
If the CEO from Moderna says, "Don't worry, I've got your back, Mr. Prime Minister," that's fine. But ultimately, I don't know what you can do with that if at the end of the day, the European Union or the European Commission says to all of the companies, you've got to check with us before you export.
Trudeau said it would be very disturbing if the EU limits exports of the coronavirus vaccine. He couldn't guarantee it wouldn't happen.
We will continue to work closely with Europe to ensure that we are receiving the vaccines that we have signed for, that we are due.
The opposition wants to know if the government has a plan B if the EU follows through and bans exports. Moderna is an American company and Pfizer has a plant in Michigan, but it says that all vaccine in the U.S. is for the U.S. Hannah Thibodeau, CBC News, Ottawa.
Well, another Canadian COVID vaccine began clinical trials today. This one made by Toronto-based Providence Therapeutics.
It's the first time a vaccine that was designed and manufactured in Canada has now entered into the clinic.
So the company plans to manufacture its vaccine in Calgary. The phase 1 trial will include 60 volunteers. Pending approval, phase 2 could start in May. The goal is to bring the vaccine to market by next January. Quebec-based Medicago is now in phase 3 of its clinical trials. Most of its doses are expected to be produced outside of Canada. And Johnson & Johnson says it expects to release data next week on the phase 3 trial of its single-dose vaccine candidate. Health Canada would then need to review it. Canada has reserved up to 38 million doses of that vaccine.
Saskatchewan's 14 deaths from COVID-19 today were a new record. But officials say daily cases are down slightly and current restrictions are working. That policy decision, though, has sparked angry protests, much of it aimed at one policy maker. Still, as you'll see from Bonnie Allen, policy may not be driving all the anger.
Brian Albert is infuriated that protesters set up outside the home of Chief Medical Health Officer Dr. Saqib Shahab on the weekend. Police are investigating whether it qualifies as harassment.
Idiots, stupid. It's crazy.
Albert's 98-year-old mother contracted COVID-19 in a long-term care home, and he has no patience for anti-maskers.
First of all, they should be the last on the list to get a vaccine, including their family members, and they should all be made to go work in one of the care homes or the hospitals. They don't have to be a doctor. Let them go wash the floors.
Shahab is far more restrained in his response, just as he was last month when an anti-masker made racist comments at a rally.
I can't get these foreigners' names right.
Shahab says vigorous debate is critical to democracy in a respectful way.
I feel sorry for my good neighbors who didn't deserve to be harassed like this, and also for my family who doesn't deserve to see and hear these kind of comments.
What we saw this weekend was a protest that moved from protesting a government decision to protesting a person. That isn't us in this province, and it needs to stop.
Today, the Premier extended current restrictions, which place some limits on businesses and households for 3 more weeks.
Really stifles.
This psychiatrist says support for Shahab should not silence debate, including criticism of Shahab's public health orders.
The voices that are the loudest tend to be the ones associated with racism or conspiracy theories. And so if you have legitimate concerns, that may not be a cause you want to associate yourself with.
I think we do need to reach the people who they say, well, I'm not going to these protests, but I am going to visit my brother.
As for Brian Albert,
I'll toe the line.
Public health officials have his complete support. Bonnie Allen, CBC News, Regina.
There is growing backlash against the Vancouver couple who traveled to Yukon to get COVID-19 vaccines.
Shows a complete lack of any sort of ethical or moral compass on people who would do such a thing. As we've also seen, they have paid a pretty high price, losing a $10 million a year job.
The province says it won't help the couple get their second dose. They will have to wait until their age group is eligible for it.
Well, mystery guests will be taking over Alberta's Jasper Park Lodge starting February 23rd. All 446 rooms at the iconic resort have been reserved for 9 weeks, meaning guests who were supposed to stay there during that time have had their bookings canceled. Several reports suggest The Bachelorette reality show will be filming its upcoming season there.
We hope next week that we'll be able to announce a lifting of certain measures after February the 8th.
Premier François Legault says health measures in Quebec are working, so his government will look at the COVID-19 situation region by region and announce some easing of restrictions, as you just heard, next week. Now, don't expect any changes for the Montreal area, though. Transmission and hospitalization rates there, still high.
Well, we all yearn for a time when we can travel more freely within Atlantic Canada and elsewhere. Now is not the time to leave P.E.I. unless it is absolutely necessary.
P.E.I.'s top doctor reminding islanders today to avoid all non-essential travel. Dr. Heather Morrison reiterated that despite the small number of active cases in P.E.I. and Nova Scotia, there will be no semblance of an Atlantic bubble, at least until the middle of February.
Joe Biden is taking action against racial injustice in the U.S.
Our soul will be troubled as long as systemic racism is allowed to persist.
Next on The National, the plan and the monumental task ahead.
When it comes to COVID vaccines, the push to prioritize the hardest hit neighborhoods.
These communities are often left behind.
And a hit movie reimagined in Mi'kmaq scores the couple behind it a surprise shout-out.
Never in our wildest dreams did we think we'd be speaking to the co-producers or creators of Chicken Run.
Turns out he's a fan. We're back in 2.
When are you gonna put it in?
And that is U.S. Vice President Kamala Harris receiving her second dose of the COVID-19 vaccine today at the National Institutes of Health near Washington. Afterwards, she reiterated the importance of Americans getting their shots as soon as it's available for them. Now, during his campaign run, Joe Biden promised to take on systemic racism if he was elected U.S. president. Today, he made an attempt at delivering on that promise. Katie Simpson shows us how.
And the simple truth is, our soul will be troubled as long as systemic racism is allowed to persist.
The president is taking his first step toward addressing urgent demands for change, acknowledging the outrage among millions of Americans over the consequences of systemic racism and inequality, fueled by the police killing of George Floyd and how the pandemic has disproportionately devastated communities of color.
We need to make equity and justice part of what we do every day.
Joe Biden signed a series of executive orders which aim to make the U.S. a more fair and just place to live. The plan includes developing a strategy to root out racial bias in federal housing policies, ending federal contracts with for-profit prisons, which benefit from mass incarcerations, a commitment to more consultation with Indigenous leaders, while fighting racism aimed at Asian and Pacific Islander communities, which has surged in the pandemic.
These aren't feel-good policies. The evidence is clear. Investing in equity is good for economic growth.
More announcements are expected on racism in policing and making the economy more inclusive for people of color.
I think you're watching an administration try to roll a very big boulder up a very steep hill and trying to do it quickly.
There is skepticism about whether Americans will support these policies. White supremacists joining in on the Capitol attack serves as a fresh reminder of the monumental problem at hand.
Do you have optimism that there can be substantive change?
I'm sorry, I didn't mean to laugh. I'm certainly at least open to seeing what their best efforts look like.
President Biden acknowledged that change will not happen overnight, but he says he wants this to at least be the start of what will be a long process. Katie Simpson, CBC News, Washington.
Well, the beauty business may be in for a reckoning. A recent study by cosmetics giant Sephora has found racial bias is a factor across the retail industry. It is an acknowledgement some Canadians say is way overdue. Jacqueline Hansen explains.
Tomi Belai Curtis is a model turned makeup creator.
When I would show up to shoots, I was expected to bring some of my makeup with me. The makeup artist wouldn't quite know what to do on my skin.
She founded Makeup for Melanin Girls 5 years ago, first as an online community to talk about which products would work, then as her own brand of eyeshadows, lip products, and more that pop on darker skin tones.
When I first started my business, the feedback I would get in general was that there's no problem. Like, Black customers aren't treated differently. Black customers don't need a separate product.
But a new study commissioned by beauty giant Sephora shows racial bias in retail persists. It surveyed shoppers across the U.S. retail industry and found nearly 4 in 5 felt there was a lack of brands owned by or made for people of color. 3 in 5 had experienced discriminatory treatment. 2 in 5 said it was based on the color of their skin. Shoppers who were Black, Indigenous, and other people of color reported being watched or followed, and reported dressing nicely or leaving bags at home to avoid being mistreated or accused of theft.
There's a belief that racialized customers are poor, that racialized customers are thieves, and that consumer racial profiling actually works.
Those myths and biases exist in Canada as well. To combat them, the Nova Scotia Human Rights Commission helped develop a free online course for retailers and their employees.
There is a significant amount of work left to be done on consumer racial profiling. And because racism is still rampant in our society, we will find it in our retail stores.
Sephora Canada says the recent U.S. survey findings will further inform changes here coming this spring.
It's an opportunity for us to take that research and really start to see what things are transferable to the Canadian marketplace.
9 teams are looking into areas for change, from employee training to diversity in hiring and brands. For Bailai Curtis, seeing change in her industry is encouraging, but also surprising after her ideas for inclusive products had been ignored by many.
It's kind of surreal now to see so much attention being brought to diversity and inclusion in beauty.
She hopes it's not superficial. Jacqueline Hansen, CBC News, Toronto.
Well, next, should some neighborhoods get the COVID vaccine before others?
They have a big chance of carrying lots of COVID from this area.
The push to prioritize high-risk communities who say this isn't about jumping the queue.
But first, a preview of a conversation you'll see here tomorrow night.
So have you been having any COVID dreams?
Yes. Are you?
Yes, I had my first one just recently in which I was at this big party and none of us have got any masks on. What are we thinking?
Margaret Atwood is in the moment, and all those neurons are firing in that extraordinary mind, making sense of our world now from the pandemic to politics.
I'm curious where you were on January 6th.
During the attempted coup.
Correct.
I think I was chewing off my finger, you see my fingernails. I think I was chewing off my fingernails like other people.
What she saw coming, what she didn't, and how on earth she invented a COVID-era tool long before COVID. That's tomorrow on The National. Welcome back. As the anticipation for vaccines rises, so does a realization it will be months before they're widely available. But in Toronto, community leaders are already asking that vulnerable neighborhoods go near the top of the list. Tonight, Ioana Remiliotis takes a closer look at the higher risks many people live with every single day.
It's a stark pandemic reality. There are places where people have fewer choices, face higher risks. Thorncliffe Park is one of them, and it's just one community desperate for a way out.
It is a community that's vulnerable. It's a very good idea in high-density community to get immunization priority.
Ontario's stay-home order has quieted the streets, but inside these apartment towers, tens of thousands of people live together, many from paycheck to paycheck. How they live, what they do, is behind a call to prioritize this entire neighborhood in East Toronto for vaccination.
So this is the space you want to show us? This is a space that we hope that the province and the public health will approve to do the immunization.
Ahmed Hussein runs the neighborhood organization here. He has a vision, and he already has a plan to turn this space, a whole floor of a former Target store, into a mass immunization site. It would give people here, he says, a fair shot at surviving the pandemic.
A lot of these buildings are 15, 20 floors, and it's a large number of families live there. When about 2,000, 3,000 people are coming down elevators at the same time when their kids are going to school, you can imagine how people will be close to each other, and that risk of spread.
Getting a vaccine sooner, what would it mean for your community?
I think immunization will really improve people to go back to work, earn an income, pay their rents, and take care of their children. We are in a prison now. We will get out of that prison.
It's a pandemic prison trapping the most vulnerable in a dangerous loop. Most people here not only live in tight quarters, many are essential workers.
I got the fever and the worst is body pain.
When Hussein Rifnaz got sick with COVID last October, everyone in his family got infected. Hussein works in public transit. He says getting vaccines here sooner could stop the virus from spreading even further from people like him who have to work even in a lockdown.
So they are going around the communities, around the city, everywhere, every corner, right, to the work. So they have a big chance of carrying lots of COVID from this area to others. So therefore, like, we should be taking care of this area first. As a prioritize, it will be helpful for the Toronto city.
Hi, we are distributing flyers to spread awareness about the COVID testing sites in Thorncliffe, and someone needs to step up and start spreading the word that it's serious and we have to obey the laws. Thank you.
The higher risks here mean public health measures are that much more critical. As a volunteer community ambassador, Tabassum Mohammadi informs people about pop-up COVID testing
We
sites
also have resources available.
and city-run isolation centers in the neighborhood. The strain, she says, of always being on guard is exhausting.
Once we get vaccinated, at least we will reduce the numbers and we all will get protected.
Would you breathe a bit easier?
Yeah, it will be easier. Mentally also, yes. We will be mentally relaxed once the vaccine is in, yeah.
Getting a vaccine sooner rather than later. It's not about jumping the queue. It's about reframing risk to recognize that in some communities, there is no escaping it. In the neighborhood of Weston Mount Dennis, in the city's northwest, the buses tell the story of people living on the outskirts and struggling to get by. The lines here are among the busiest in the city, taking people to work in factories, grocery stores, nursing homes. That risk comes back home, where many residents also live with multiple family members.
It's not that people don't want to follow the public health regulations. The issue is that they cannot always follow public health regulations. And the reason that they cannot is because there's systemic barriers that don't allow them to follow them.
Hey, Abu Bakr, how are you?
Michelle Joseph runs Unison Health and Community Services and oversees pop-up testing sites set up in the area. The barriers, she says, include poverty and lack of paid sick leave. Many residents hold multiple jobs and can't always afford to stop working, even when they don't feel well. Putting people here on top of a vaccine list is about recognizing the danger in their disadvantage.
These communities are often left behind. They're under-resourced, they're historically under-resourced. All of these issues existed pre-COVID, these inequities. I think that it's very important that we ensure that they're not forgotten. They are experiencing a disproportionate level of COVID and also the impacts of COVID. We should make sure that they're a priority.
To strengthen that call, several vulnerable communities have banded together, tied by common threads of inequity that grow more urgent by the day. Further west, the community of Rexdale, another low-income neighborhood hit hard by COVID. The need for food has skyrocketed in the last few months as people lost jobs.
These people, they have bills and they have to pay those bills. Because
Pascal Lumbala is with the Rexdale Community Health Center. He says those who are still working are still at risk.
80% of the jobs these people have, they're like frontliners. So I think this community is really vulnerable and they really need the vaccine.
Hi.
Back in Thorncliffe Park, Tabassum says until vaccines get here, she will keep making the case for safety.
Yeah? Okay. It's a home here, and I want to protect all my family members. Like, this building is a home for me.
Are you scared?
I am. It's not easy.
It's not easy, and it's not clear when people here will find out where they end up on a vaccine list. Meanwhile, there's no denying the need or the commitment to keep fighting because of it.
The COVID created this, and we hope the immunization, a vaccine, will shut down this.
In a corner of that massive floor that could be a vaccination site, a food bank for people in need here too. Ahmed wants nothing more than to see it go.
So when you look around this space, Ahmed, what does it symbolize to you?
It symbolizes to us a space of hope. This is a space that we will say that goodbye COVID.
There is a way out, he says, And this can be the place that proves there is promise in the emptiness.
And so Joanna joins us now outside that potential vaccination site. So they have the space. What's next?
Well, Adrian, there are challenges ahead, including vaccine hesitancy. Community leaders we spoke to say while many residents in their areas are quite willing to get a vaccine and are in fact quite eager, some are hesitant. And that stems from misinformation, mostly on social media, about severe, terrible side effects or about ingredients in the vaccines that go against religious and cultural beliefs. It's why education and awareness is the key strategy right now, and community groups have aligned with local health authorities to develop strategies. Here in Thorncliffe Park, they're setting up focus groups to identify specific concerns. They're enlisting religious and community influencers, and they're also launching social media campaigns in several different languages. They're saying that it's going to be a while before vaccines get here, and if they're going to make the case for prioritization, they want to be ready.
Well, they will be ready. All right, Joanna, thanks very much.
And when we come back, violent protests on the streets of India's capital. A historic landmark occupied. Tens of thousands of farmers say they are fighting for their livelihoods. Well, a 14-year-old boy is dead and dozens injured after a tornado tore through a suburb of Birmingham, Alabama last night. The teenager was sheltering in the basement of his house when it collapsed. On the streets today, scenes of destruction, piles of debris where houses once stood, and roads blocked by downed trees and power lines. In Brazil, 19 people were killed when a bus veered off a cliff yesterday. More than 30 others were hurt. The driver was not injured and is being questioned to determine the cause of the crash. And at least one person is dead and many more injured after protests in India turned violent. Thousands of farmers, furious over government policies, stormed barricades and clashed with police in New Delhi. It's a major escalation in a protest that has been going on for months. Greg Rasmussen has more on today's violence and support for the farmers here in Canada.
The streets erupted in running battles, with farmers and their supporters pitted against riot police. At one point, they tore down barricades and occupied the Red Fort, a 380-year-old historical site in New Delhi. For 2 months now, thousands of farmers have been encamped in the area, fighting against laws introduced last year deregulating parts of the country's huge agricultural sector. We will not go to our homes. We will not go anywhere until the laws are repealed, whatever happens.
No farmers! No food!
In snowy Toronto, a crowd gathered in support.
Well, the weather is not on our side, but the commitment here certainly is that all these individuals who are praying in hopes of a better future for their families back in India.
This gathering in New York was just one of many where people turned out in opposition to India's Prime Minister Narendra Modi's new farm policies. Modi says the changes will allow farmers to prosper in a freer market, but millions of small landholders fear the loss of subsidies will wipe them out.
We will continue to support the farmers.
It's not just the people from Punjab and India supporting them, it's people all over the world supporting them.
But our people, our families that are there.
Many at today's protest have close connections to those on India's farms.
The farmers themselves have camped out for 2 months now, and they're ready with 6 months to a year. They're not going anywhere. So this is not going to end the way the Indian government thought it was going to.
After months of protests and now street battles, the question is whether demonstrations like this one here and around the world will make a difference. Greg Rasmussen, CBC News, Vancouver.
Next, we'll take you to a COVID hotspot and the source of one of the variant strains. How doctors in Brazil are grappling with a surge in patients, destructive leadership, and in some places, a test positivity rate of 60%.
I'm Jamie Poisson, and tomorrow on CBC's Daily News podcast, Front Burner, what do you do when someone you love gets sucked down a conspiracy theory rabbit hole? We bring you one woman's story. Subscribe wherever you get your podcasts.
The world hit an alarming point of this pandemic today. Only 3 months after reaching 50 million COVID cases worldwide, there are now more than 100 million people who have contracted the coronavirus. One of the hardest hit countries is Brazil, where nearly 9 million people have been infected. And as our Sasha Petrusik reports, the situation there appears only to be getting worse.
A desperate crowd gathers in front of the main hospital in Brazil's Amazon region. With a death rate 4 times Canada's, this is one of the worst places in the world for COVID. Where is the help? Yells the daughter of one patient. People are dying here. It's not a game. ICU units are overwhelmed. The region's supply of oxygen for the sick has all but run out, and teams from the mortuary patrol streets, picking up bodies from homes. Across Brazil, thousands are buried every day in new COVID graveyards that stretch to the horizon. With more than 215,000 dead, the country's death toll is second only to the U.S. The aid group Doctors Without Borders is scrambling to help in remote Indigenous communities here.
The last 2 weeks, we've seen a sharp increase.
5-fold increases in 10 days.
Basically, 50 to 60% of the people that we test positive. So that's a huge amount. So
a spread so fast, perhaps because of a more contagious new strain in Brazil, and because of the actions of Brazil's president, Jair Bolsonaro. For months, he's played down the danger of infection, and while vaccinations have now started, Brazil has less than 5% of the shots it needs. Bolsonaro has publicly questioned the vaccine's safety.
Lá, na Pfizer.
The risk is yours, he said recently. If you turn into an alligator, that's your problem. In the densely packed, poor neighborhoods of Rio de Janeiro, doctors struggle to treat 40 infected patients in every shift.
We don't have the equipment to treat the patients, and the government don't want to do the lockdown. I feel very sad, very angry sometimes, and very tired, very tired.
Treisman blames an indifferent president and a healthcare system that favors the rich. He says with the rate of COVID spread in Brazil, everyone is now at risk. Sasha Petrusik, CBC News, Toronto.
Okay, still to come on The National. A special moment courtesy of a movie you may have forgotten about. Hear how one Nova Scotia couple's hard work led to a very special conversation with the film's director. Our moment is next. Well, this animation might look a little familiar to you. It is, of course, the movie Chicken Run, made more than 20 years ago. But this version has a twist. It's been dubbed in the Mi'kmaq language. Now, it was a couple in Nova Scotia who took it upon themselves to translate and revoice the movie a while back as a way to keep their language alive. But recently, they got something of a shout-out for their hard work. And tonight, it's our moment.
We took off the vocals of the animals in the movie and replaced that audio with from English to Mi'kmaq.
We did this for fun. It kind of gained its own life, its own momentum.
Next thing you know, we get a shout out from Peter Lord, and oh my God, like we knew he was one of the creators. We were just, wow, where did this come from?
Ever since our first interview with CBC Main Street, they reached out, I think, to Peter. We just have completed an interview with Peter Lord.
Nice to hear you. Nice to hear from both of you.
Nice to hear from you as well, my goodness.
I'm starstruck.
Never in our wildest dreams did we think we'd be speaking to the co-producers or creators of Chicken Run.
So that's pretty cool. And you may be wondering, why Chicken Run? Well, Tom, apparently his 4-year-old nephew at the time, he wanted him to be able to watch a movie in Mi'kmaq, and his dad recommended chicken run, so they did it.
Why not?
Yeah.
So apparently Eliza was speaking with Tom and Caroline and learned that it's not perfectly overdubbed, obviously. It's the essence of what's being said, but there are special references in there that Mi'kmaq people will particularly enjoy, apparently. So that is a national for January the 26th.
Good night.